So we have a patient presented with right-sided hemiparesis that completely resolved in 6 hours. So again, this is the hint in the MCQ, like a patient is having hemiparesis which is resolving in less than 24 hours. So clear-cut diagnosis with this will be TIA. So it is a case of transient ischemic attack. So remember, for TIA, to define TIA, remember the time limit is 24 hours. So if a person who is having stroke-like presentation and there is a complete resolution in less than 24 hours, we call that TIA. And most TIA, they will resolve in less than 1 hour. Now, what score will you use to determine the risk of future stroke in this patient? So remember, understand this, we have discussed in the class also. For like any TIA patient, if you want to predict future chances of stroke, and we have to start them antiplatelet, or I can say anticoagulant. In that case, we use a score. That score is ABCD2 score. ABC2 score. So understand this. ABCD2 score meaning is age of the patient. So higher the age, higher is the chance of stroke. So if age is more than 60 years, we say like we give 1 point. Then B stand for BP. If patient BP is high, then again like patient hypertensive, that will give, then we will give 1 point. C stand for clinical features. So in clinical features, we have two things, like either my patient is coming to you with hemiparesis. So I can say unilateral hemiparesis, or my patient is coming with sudden loss of speech or speech impairment. So for higher age, we give 1 point. For hypertension, we give 1 point. For hemiparesis, we give 2 points. For speech loss, or I can say speech impairment. Now understand, if duration, D stand for duration. So duration, if it is less than 10 minutes, then we give nothing, we give score of 0. If it is in the range of 10 to 59 minutes, we give 1 point. And if it is more than 1 hour or more than 60 minutes, then we give 2 points. So higher the score, higher will be the chance of stroke in future. So you have to remember ABCD2 score. Okay, to tell you about these other things, CHATS S2 VAS score. This is a score. This is like we use to initiate, I can say, antiplatelet drug, or I can say anticoagulant drug in a patient who is having atrial fibrillation. So remember, CHATS VAS score. It is to use embolus prophylaxis in atrial fibrillation. So in a patient having atrial fibrillation, there is a chance like he or she can develop, I can say, emboli, and to prevent that emboli, what we are giving antiplatelet and anticoagulant. Curve 65 score, it is to assess the severity of pneumonia. It is to assess severity of pneumonia. And based on this score, we have to decide like it's a case of pneumonia, whether to admit this patient and where to admit this patient. Means suppose if score value is less, then we can simply discharge the patient. So treatment will be OPD basis. So you can start a macrolide or beta-lactam and tell the patient to take these medications for 5 to 7 days. If score value is more, then we need to decide, is it an ICU admission or it is a non-ICU simple ward admission. ABC2 we have discussed. Apache 2 score is used to assess severity in acute pancreatitis. So to assess the severity in pancreatitis, what we have Apache 2 score. So these are some scores which you have to remember.